Also, as a reminder, if you are tweeting on this, it's THP 2016. And to get us started today, this is our first panel around what's going to happen in the Texas legislature. I think we've been talking quite a bit about federal issues and the presidential race, but this is our first panel to kind of get started talking about what we expect to see next session, especially around Medicaid. And our moderator is Albert Hawkins, who does not really need an introduction for most of us in the room. He was the Health and Human Services Commissioner from 2003 to 2009. Oh, yeah, I remember fondly because my very first session working in the Capitol, that first year was his first year as commissioner. So I spent a lot of time learning from Albert Hawkins. Prior to that, Albert did work in the White House with George Bush as the Secretary of the Cabinet and with OMB. And part of that, he worked in the George Bush's governor's office as the budget director, and has had a very long career in government, 30 years, I believe. So I'm going to let Albert introduce everyone and get everything started. Thank you, Albert.
Thank you, and good afternoon, and I appreciate that Jamie didn't call me old. But I'd like to welcome you to this panel discussion. The topic for this session is forecasting the 85th legislative session. And we have 3 panel participants who will be actively engaged during the 85th legislative session. The regular session of the Texas legislature will convene on January 10th. I know everybody's keeping track of that. If you're also looking ahead, signing die is May 29th. And so you can circle your calendars for that. This session, the governor, lieutenant governor, and 181 or 180 members of the House and Senate will begin deliberations in a much more challenging fiscal environment than they confronted 2 years ago. Last session, they opened with an $8 billion beginning balance. It is projected that this session will open with about $1.5 billion. It is expected that the legislature will have to resolve a multi-million-dollar budget shortfall. Our past experience tells us that budget issues will dominate the session. However, other significant issues will demand attention as well. We'll ask our panel to explore with us the key issues they anticipate, and I will pose a few questions for discussion, and then I will open it up for questions from the floor. Let me begin by introducing our panelists for this afternoon. State Representative Stephanie Klick was first elected in November 2012. She represents House District 91, which serves the cities of Halton City, Richland Hills, North Richland Hills, Watauga, and a portion of Fort Worth. Representative Klick is a native Texan with strong ties across the district, where she also attended school in House District 91. She was a candy striper at North Hills Medical Center in North Richland Hills, where she developed a passion for nursing. After working her way through college and graduating from Texas Christian University with a Bachelor of Science in Nursing, she returned to North Hills Medical Center and rose to the position of nursing supervisor before leaving to become a nursing consultant. While serving as a consultant, she has coordinated the care of catastrophically injured and served as compliance consultant for long-term care facilities for the developmentally disabled. In total, Representative Klick has over 30 years of nursing experience. She also served as chairman of the Tarrant County Republican Party for 6 years. Stephanie and her husband, Don, have been married for 32 years. During the 84th legislative session, she was appointed to serve on the committees of Human Services and Pensions. She was also elected to serve as chair of the Tarrant County delegation. Welcome to Representative Klick. Our next panelist is State Representative Ron Simmons. In May 2012, after personally knocking on more than 3,000 doors in House District 65, Ron Simmons won the Republican nomination for state representative and went on to win the general election in November and was sworn in on January 8th, 2013. During his first term in the Texas House, he authored and passed legislation protecting First Amendment rights and the integrity of Texas's election process. He also authored and passed legislation standardizing the treatment and coverage of autism spectrum disorder. This landmark legislation which is expected to lead to earlier diagnoses, better outcomes for individuals on the spectrum, and lower costs for insurance providers in the future. He also co-authored House Bill 2, which is an historic pro-life bill, as well as House Bills 508 and House Bill 800, which provided tax relief. He was honored to be named the most valuable player of the 2013 freshman class by Capital Insight. Ron grew up in rural southern Arkansas and began his studies at Southern Arkansas University, where he met his wife. Ron and Lisa married in 1980 and moved to Dallas in 1985. Representative Simmons earned a bachelor's degree in business from Dallas Baptist University, and that university named him a distinguished alumnus for 2012. He co-founded Retirement Advisors of America in 1991 and continues to serve as its chairman. In 2010, he was named one of the top financial advisors in the Dallas-Fort Worth area. In the Texas Health, Representative Simmons is a member of the House Transportation Committee and serves as vice chairman of House Business and Industry Committee. He is also on the executive committee for the Texas Office for the Prevention of Developmental Disabilities and was unanimously elected to the Texas Conservative Coalition Research Institute Board of Directors. Let's welcome Representative Ron Simmons. Our final panelist is Charles Smith. Charles was appointed by Governor Greg Abbott to serve as the Executive Commissioner for Health and Human Services effective June 1st, 2016. In this role, the Commissioner Smith oversees the policies, programs, and operations of the HHS system in Texas. Prior to his appointment, he served as Chief Deputy Executive Commissioner at the agency, and during his tenure at HHSC, Commissioner Smith has worked to improve the agency's efficiency and accountability to Texas citizens. Previous to his service at HHSC, Commissioner Smith served as the Deputy AG for Child Support at the Office of the Attorney General. He was responsible for the overall delivery of child support services performed by the division's 2,700 employees. He began his career as a volunteer in the Child Support Division in 1988 and attained positions of increasing responsibility during his 26-year career within the division. His work in the area of child support earned him multiple awards throughout his career, and under Smith's leadership, the Texas Child Support Division was recognized as the most efficient and effective program in the nation for 2 years in a row. Commissioner Smith is a graduate of Texas Tech University. Let's welcome Executive Commissioner Charles Smith. To start our discussion this afternoon, I'd like maybe to turn it over to each panelist to share about 3 or 4 minutes of thoughts about the 85th legislative session, what they see as the priorities, and what kinds of expectations they bring into the session. Let's start with Representative Ron Simmons.
Thank you very much. Thank you for letting me be here today. Believe it or not, I started my career at a oil company in Arkansas called Murphy Oil. And they were a pretty big company in a small town, but I started after being in the mailroom and what have you. I got promoted up to the employee benefit area, and one of the things that we did is we self-administered our own health plan for our couple thousand employees. So, I mean, we literally paid the claims in the office. I mean, it was something else. So, I have some background in that, although it's older, and I've run a small business, so. Obviously, as a small business owner, been involved in securing health coverage for our employees, which I could, as all of you would know, is not an easy task these days. You know, the 85th session, like Albert said, is going to be a challenging one, and we're going to spend a lot of time talking about the budget. The budget, not with the excluding Commissioner Smith's agency, because I know his doesn't do this, but a lot of agencies will load up their budget requests knowing that we've got to say no to something. It's kind of like your kids, you know, they really want $5, but they come and ask for 20. And then you get them down to 5, you think you've won, and they know they've won. So it happens a little bit like that in the legislative session. And so there'll be some pretty difficult discussions to have. What we have to make sure is that we have to make sure that we fund our core services appropriately, and this will cause us then to look for inefficiencies in other areas. Governor Abbott has called on agencies to look at reducing their budget by up to 4%. And what the legislature will be tasked to do is looking at that as to where those cuts are made. Believe it or not, there are some agencies that will put together cuts on programs that they know representatives might or senators might be very fond of, knowing that they're not going to cut those, right? And so it's a little bit of a game, but we'll all get together, it'll all get done. That's the only bill that we have to pass. There are not any other bills that we have to pass. But I think that's something that we'll be dealing with. There'll be some other issues that come up. We're going to deal with education. School choice is going to be a big issue. I filed a special needs school choice, restricted only to special needs people. I filed that this morning. House Bill 68, if you want to follow that. This is really just a shell. We've got some adjustments to make to it. And for me, one of the things that really after meeting with some of your representatives, I've got to figure out whether or not that I'm going to need to file a bill to tighten the requirements for Texas health plans to cover ABA and autism-related therapy, because I've had many complaints from constituents that after we pass the bill, health plans in Texas are refusing to cover therapy for these kids with autism. And that's not the intent at all. So if you're one of those plans, then we're going to need to have what we would say at our house, a come to Jesus meeting, because we're not going to hurt these kids. And there's no way that we're going to do that. And so whatever I have to do, and whatever we have to do as a legislature, we're going to do. And a lot of you are doing it perfectly well, and I really appreciate it. And if there are ways that we can make the law better, please let us know that. We want to know that. I don't have any, my child is 30 years old, so he's not involved in this anymore. But I get time and time again, these kids and these families just get at a loss because they need this treatment. And when the insurance fails to cover it, it's a problem. So I'm going to be looking at that very closely and dealing with that and helping on the budget. And of course, we got lots of issues in transportation. We spend a lot of money in transportation, invest a lot of money, but we have to keep people moving through this state.
Thanks for having me here today. As Ron mentioned, the budget is going to be tighter this session. I think one of the areas that you're likely to see a lot of energy and time invested this next session is on CPS and foster care reforms. And I've been part of a work group for a number of months that have been dealing with those issues. And I think we have the commitment from the big three that we're going to see some reform there, and am looking forward to working on that. One of the things that I think will be on the agenda this session that perhaps some of us in this room hadn't fully thought about is after Tuesday's election, it opens up many possibilities in regards to health care. I think the Affordable Care Act has been a disaster for many constituents. Premiums going up, difficulty finding coverage, and so forth. I think that we have an opportunity to step back and look at new ways of doing things. No one is quite sure what a President Trump will do in the way of repealing things, but I suspect some of the things that will be happening will be through the reconciliation process on the budget. There's likely to be, through executive orders, the possibility of reducing some of the minimum required coverage benefits. When many of those were included in those plans, I don't believe that anyone at the federal level was really thinking about the cost that adds to premiums. There are a lot of people that want coverage for items with no copay or no deductible, but someone is paying for it, and generally it's reflected in premiums. So I think that we have some opportunities there. I think we may have some opportunities regarding the Medicaid program with different leadership. Some of the minimums that are required, even through Medicaid, whether or not waivers could be done. Block grants to the state has certainly been talked about. A number of states have applied to CMS to reduce some of the minimums. Kentucky has petitioned CMS to do work requirements for some populations. Personal responsibility agreements, potential copays for some of the services under that plan. I think we have a great opportunity here to make things better. You know, anytime there's disruption, there's an opportunity for innovation, and that's what we have right now. So I'm looking forward and kind of excited about the opportunities.
Well, good afternoon, and thank you, Albert, and thank you all for allowing me to be here with you today. And I'm just going to say I want to echo what Representative Simmons and Representative Klick just said, and so that's it for me. Okay, maybe not.
You weren't going to get off that easy.
I tried. Well, I will say that just following on the same lines, it has been made very clear to me as one who has about 40% of the state budget is within my agency, that it's going to be a very lean budget year. And so they want us to make sure at HHS that we have done everything to go back and scrub our budget, and the things that we are asking for are those things that are truly needed, and to prioritize them. And so we have done that. One of the things that, because the way I operate over the years, one of the things that we've done is to do exactly what Representative Simmons mentioned not to do. And so what we did when we submitted our legislative appropriations request is we did not offer up those programs as the 4% reductions that we had to submit that we knew were not likely to happen. So the challenge was to go and talk to our staff about going through this process systematically, where we truly saw an opportunity for savings. Things that we could do in a different way, things that we may not have been receiving or having the return on investment, that we would be able to look and do something differently. And so that's the way that we will continue to operate HHS as long as I'm there. And so part of this is to continually look at how we can become more efficient and effective with our normal operations. How we can bend the cost curve and the cost growth of healthcare in this state while still providing the highest quality of healthcare for the state's most vulnerable populations that are part of our systems. And I think that there is a way for us to be able to do that. But it's going to take the people working within HHS and all of you all and everyone else in the stakeholder and advocate community as a whole, and providers working together to really begin to try and find a better way of delivering quality health care. And so we're going to have to transform our system in order to be able to do that. And so we're going to look at value-based purchasing. We're going to look at alternative payment models. We're going to look at ACOs and all of those type of things that can allow providers and plans to share in the savings, but at the same time bending down the cost growth, because as I was visiting with Lieutenant Governor just last week, and he was talking about the growth of Article 2 compared to Article 3. And so the concerns that we're doing there. And so we're going to continue to follow the lead of the governor, lieutenant governor, and speaker in reducing and bending the cost curve. As Representative Klick said, one of the top priorities, as has been communicated to me, deals with child protective services. As a state, we have to, as a state agency, we have to do better. We can do better in delivering the services to our state's most vulnerable, our children. And so we're going to continue to work with DFPS to ensure that we transform their system, so that we can provide and make sure that we can meet the primary initiative and requirement and vision of that agency, which is protecting children from abuse and neglect. And that starts first and foremost by being able to see and get to those children. And so we're going to build a process that will continue to build upon that direction. The other thing that we see as our next looming item for the legislature is to deal with the infrastructure associated with our state hospitals and our state supported living centers. As I have traveled around the state visiting these facilities, they are in different areas and different types of disarray and oftentimes in decay. And so they need a lot of funds to bring them up to speed. However, before we get there, what I want to do is to ask the legislature to give us direction. And so my administrative statement in the LAR was a request for the legislature to provide us a vision for the state-supported living centers and state hospitals for the state of Texas. And once we get that vision, then it'll be responsible for me and the staff at HHS to then enact upon that vision. And so that means where they're located, the type of facilities, whether or not we're going to build new facilities or rehab the current facilities that we have. And so all of that is encompassed in that. The other part of that, and it's closely linked, at least with the state hospitals, as I've traveled around, I've talked to lots of county judges and commissioners and sheriffs who've talked to me about the number of people who are in their jails waiting for mental health and behavioral health treatment. And so the legislature commissioned a study, the behavioral health strategic plan, and we submitted that. And so mental health and behavioral health needs in the state continues to rise. I've toured facilities just this past week in El Paso, their El Paso Psychiatric Center. And I was at Parkland a little bit ago looking at their mental health system that they have. They're attached to the emergency department. And you see the number of people who continually come through the emergency departments as well as those who enter the criminal justice system as a result of substance abuse, behavioral health, and mental health issues. And so it's a crisis in our state, and as we begin to move forward and pull together the work of the 14 agencies that were part of the behavioral health strategic plan, as well as the Medicaid system, there's already about $6.7 billion biennially that is spent in our state on behavioral health and mental health. And so what we're going to be doing is trying to work collaboratively to work and break down silos across the system so that we can, again, improve the quality of health care, leverage the dollars that are already being spent in the system before we actually start asking for more dollars in the system, and ensure that we have a way of measuring the dollars that are being spent now to ensure that it's actually reaching its desired objectives. And so those are some of the big ticket items, and so I'll leave it at that.
Thank you. Thank you for those comments and thoughts. Each of our panelists incorporated some aspect of the budget challenge into their remarks, and I'd like to get back to that. But there's been sort of a continuing discussion through today's sessions about the Affordable Care Act and the opportunity for change that appears to be presented on that front. We all know that President-elect Trump has committed to repeal and replace Obamacare. And so I'd like to get some of your thoughts about what changes in the Affordable Care Act do you think might be most beneficial to our state, and particularly the Medicaid program, if there are some things that you have in mind there.
I would say changing to a block grant would be great, which would give us a whole lot of flexibility. A number of states that have expanded Medicaid have seen the price trajectory continue to climb, and find it not to be a sustainable model. I think that we need to look at, as I mentioned before, some of the personal responsibility agreements, co-pays where appropriate, to discourage non-emergency use of ERs. We need to look at not only the costs, but we need to look at outcomes too, because bad outcomes cost more.
And just to go in a slightly different direction, I agree with Representative Klick, but aspects of the ACA that currently have an impact on the state are also the eligibility requirements. Those standards changed quite significantly under the Affordable Care Act. Another change that happened under the Affordable Care Act that a lot of people may not realize even was that the federal government, CMS, did not allow Texas to ask for some specific questions associated with other parents who might be responsible for providing child support services and things of that nature. Because again, if you have a person that is applying and they're proved to be eligible for Medicaid, then one of the other things that we would do oftentimes was ask that person if they had children, and in case which they did, was there someone else who was responsible for providing financial support for this child? And if not, it was asking that person to provide that individual's name and information so that that could make a referral to the Title 4D agency in Texas, that's the Attorney General's Office Child Support Division, so that they could open a case and begin collecting child support. Again, a way to help this parent be self-sufficient who is now needing state services. And so the federal government did not allow that. And so those are some of the things that, again, I think there's an opportunity for government to help people help themselves and personal responsibility. And so those are some of the elements there that are associated with the Affordable Care Act that, going forward in the future, whatever we have that's replaced, I'm assuming will likely allow the system to work because the child support system was extremely instrumental at helping the state avoid as much as $1.5 billion in costs to Medicaid, TANF, and SNAP, and CHIP, because the child support program gets health care through the non-custodial parent, which then Medicaid becomes the payer of last resort, which of course reduces the amount of funds on the state. But when those aspects were removed, then it makes it extremely difficult for HHS to then get that information from the custodial parent, oftentimes the mother in that case. And so I think those are some of the things that we can look forward to. There are also some things that were there that were changes that have benefited the state. Community first choice, as an example, is a way for cost to be lowered because people are now living in the community as opposed to being in an institutional type setting. And so there are some things there that we'll be interested to see what happens going forward.
Great. Representative Simmons, you have any? Okay, so let's turn to the budget because we know that's kind of the elephant in the room, and Health and Human Services represents a significant portion of our state spending. It's always been accused of crowding out other spending priorities. So we know that there's going to have to be some approach taken to dealing with the cost increases that are typically associated with delivering health and human services. What recommendations would you share with us about how to approach the critical budget needs in health and human services given the tight fiscal environment that we have? Representative Simmons.
Well, you have to remember every program in the budget, no matter which agency it's in, has a constituency and has advocates. And and when it's explained to you, when you're sitting and you're committee chair and there are people out there talking, all of them make sense. There's no question about it. And the problem is there's very few of them that you could say, well, this is bad. So it's easy to separate good from bad. It's hard to determine good from best. And that's where we are. In my opinion, the best way from a cost saving standpoint, because remember, Medicaid started in the 60s with the federal government paying 90%. Does that sound familiar? And now they pay 60-something%, somewhere in that neighborhood. So that's another reason some of us were against Obamacare, is because it started at 90, but it's not going to stay at 90, or it wouldn't have stayed at 90. To me, and this has been mentioned before, the best place to find the savings is through eligibility. I believe that Medicaid should be for the disabled that need it financially, the elderly that need it financially, for the children that need it financially, and that is it. There should not be an able-bodied person, okay, outside of those categories, and these categories all have challenges, that are on Medicaid. I'm sorry, maybe I could be tempted for something for the acutely unemployed, meaning they're recently unemployed, they've lost their along with that. But that, for me, that's where we should be. That's what this is for. This is a safety net of last resort for people that have no other means by which they can receive coverage. That's the way I look at it, and that's where I think the biggest cost savings would be.
Thank you.
I think a lot of the states that expanded Medicaid to able-bodied single adults are having to cut programs for the truly needy and disabled. And I, back during the summer, was in New Mexico for vacation. And in the resort town that I was at, the New Mexico legislature was having a budget finance hearing. And they were trying to fill a big hole in their budget, and it was directly related to Medicaid expansion. Once the split reduced and they were having to pick up more of the cost of the program, they were going to take a financial hit. And again, I think most of the public understands that these are safety net programs for the truly needy and disabled, and did not support extending those benefits to single working adults.
Well, not being a member of the legislature, I will basically say that from our perspective, what we're going to try and do is make sure that we and that I communicate, and my staff, that we communicate our needs. And I think that's the important thing, is that the legislature knows what our needs are. Not our wants, but our needs. And so I think it's going to be important for us to get that message across, to provide them the information that is necessary so that they can then set the policy decision. And then what we will do is go back and implement the policy. And so it's going to be really just as simple as that. We will continually look to see what we can do better to improve processes. We want to streamline processes. We're taking a look at issues that our providers have with the system to try and get more providers in. We want to take a look at the different payment mechanisms that we have associated with the system and what we pay for different things, and to really see, are we paying for things appropriately, and where things are out of whack, this is a technical term, then what we will do is to try and right size them. And so that's going to really be the process. And so are we overpaying for something that we should not be we should never overpay. Are we overpaying for something? And whether that's durable medical equipment or pharmacy drugs or whatever it may be. And going back and looking, because we do have a tremendous amount of money that is flowing through the healthcare system. And what I believe firmly that we can do is look to see how that money is flowing. And if there is a better way for us to flow those funds through the system without actually going in and always asking for new funds, then we owe that to the taxpayers to be able to make that charge and to try and do that.
Thank you. Commissioner Smith mentioned in his remarks the focus on some mental health services and behavioral health, and I know as state representatives you deal with that on an ongoing basis in your local communities and in your districts. Do you anticipate seeing any legislation passed to address that, or is it funding, or how would you see the legislature tackling the issue of mental health services?
Well, it's something that we've talked about, and whether or not this session gets the real action, because there will be some funding needs associated with it. A lot of it deals, as I believe Commissioner Smith said, with our criminal justice system and figuring out how to get, and in many of these cases, community-based mental health care for these people that are that are erroneously, not that they didn't commit a crime, but the best place for them is not in the criminal justice system. So that's the biggest difference I think we can make for the state. We have to figure out how to do that in a compassionate yet conservative manner. But I do think it's an onus on us, and it's, you know, the challenge that I have since I've got into this, I come from a small business background, is that for all of these things that we're talking about, the government's really supposed to be the point of last resort. Many of these items are social things that the rest of society has just kind of said, we're just going to turn this over to the government. That's the business community, the faith community, just the social fabric of all of us. We would rather for the government to handle that. And that's gotten us right where it is today. In some cases, the government's the absolute worst people to handle it. Not that they don't want to do a good job, just the way government works. And it shows up here in the mental health people that are in our jails. And so if we're going to do something, I see that's where that's coming from.
With CPS and foster care being in the news a great deal, the most common reason that children end up in state care is because they have a parent that's got a mental health condition or an addiction problem. So that bleeds into other areas of the state budget. One of the things that was very startling to me when I first came to the legislature as to who the largest mental health provider in the state was. I was very surprised to learn it's the Harris County Jail. And we do need, I think there could be cost savings in setting up programs to divert some of those folks out of the criminal justice system and get them into treatment. But one of the problems that we have as far as treatment is we have a shortage of mental health professionals to treat these folks. Last session, we passed legislation that was a loan forgiveness program for nurse practitioners and psychiatrists that are going into the area of mental health. We're going to have to look at new models to address the shortage areas so that these folks can get into treatment sooner before they get into a crisis and require inpatient care. That is an area that we can reduce cost.
I think it's important that as we look at mental health and behavioral health is that we look at the preventative cost. And so what I think we can do is try and reach people before they enter the system, the criminal justice system, before, while they're either in school or if they're having a mental health crisis outside of after they've graduated from high school, is to make sure that we have the appropriate services in the community to meet and address their needs before they enter the criminal justice system or these other systems. And Representative Klick talked about the shortage. When I was at the Texas Tech Health Science Center in El Paso this past Thursday and was talking to one of the psychiatrists there in the teaching school, she told me that there were 8,000 psychiatrists, not in Texas, in the country. Just think about that. A country of more than 300 million people who we all see and understand the mental health crisis that's going on. And there are 8,000 psychiatrists. I didn't fact check that, that's what she told me. And so I'm assuming some of you all possibly can. But if that is accurate, and that is a scary thought. This morning I was speaking to one of the lead psychiatrists at Parkland, and so about their training class and what they're doing to increase psychiatry. And it's a epidemic that we have in Texas. We have areas of the state that doesn't have a single psychiatrist there to practice. And so it's going to require us to be innovative in our delivery of services, whether that's through telemedicine or something else, until the actual physical needs can be met as the medical schools go through the process of developing and training and putting psychiatrists out into the market. And then the other thing that we're looking at from the HHS perspective is, reimbursement rates. That's another thing that I have heard about from a lot of different people, is the rates at which we reimburse for different types of services. And again, it's one of those things where we're going to go through systematically and begin to look at what we're doing, what we're charging, what we're paying for and reimbursing, and ensuring that things are appropriate. And I want to also clarify one thing. I don't have a problem with asking and going to the legislature and asking for additional funds. However, my issue is that's not going to be the first reaction of our agency. We're going to look inward and see what we can do, what should be done, if there's an opportunity to redistribute the funds that we currently have that are flowing through the system. And only after that can't happen will we actually go out and start seeking additional funds for whatever the appropriate reason is.
Thank you. We have a few minutes left. Why don't we open it up for some questions from you in the audience? I warned Tom Cease I'd call on him if nobody else has a question. So
Nobody's going to ask the question, where's the
somebody
bar,
please, so
when
we
is it
don't-
open?
So we don't have to have a question from Tom.
Hi, I'm Colleen Horton. I'm with the Hogg Foundation for Mental Health at the University of Texas, and I'm obviously very pleased to hear the discussion around mental health, and totally agree that we can do a lot of things, but if we don't have the workforce, then all the other actions we take are going to be primarily for naught. There's a number of things we can do that I've talked to you, Commissioner Smith, and Representative Klick about, everything from improving integrated health care to peer services to better training for primary physicians. But we don't have a plan for developing the mental health workforce. We go into each session and we're lucky to get 1 or 2 bills passed, and that's not going to address the problem. So my question is, what are your thoughts about really creating a strategic work plan for short-term, long-term, mid-term goals for developing the mental health workforce?
Obviously, if you don't put a goal forth, it's a whole lot harder to hit the target, if you will. I agree that that's an important thing. Some facilities around the state are using the peer assistance model that has been very successful to help in workforce shortages. I'd like to see that expanded around the state, because I do think that that is a niche. It's thinking outside the box to assist those in need in a time when we have few providers. So we do need a plan.
You know, we have a lot of great universities, which you're obviously with one of them here in our state, and it seems like to me that that's a good place to start is maybe some of our universities that have and our nonprofits that deal with mental health, maybe they can get together and come up with some ideas to outline a plan. I mean, we certainly work better when things are started for us, right? Asking the legislature to come from something scratch that's a recipe for trouble sometimes. But I think it's an absolutely great idea because Stephanie's right. We won't get there with piecemeal, and I appreciate you bringing that up. And maybe, you know, we had a similar type scenario with autism last session in that we looked around and there were many universities that had these autism centers, right, that have study programs on autism, and they're training their students on treating autism, whatever, but they didn't ever talk to each other. So Senator Nelson and some others of us put together a program that encouraged them with the Higher Education Board to share ideas, to come up with plans for Texas. There's hundreds of thousands of children that are on the autism spectrum, and getting those children treatment. So these universities are now supposed to be coming up with programs, working with local school districts to have some of their graduate students in those school districts helping provide some of those services that are needed for kids that are on the spectrum. And that's the way we can get services to more people. That's just kind of one way to do what you're talking about, is to have a master plan. But the first thing we have to do is get people talking to each other that are dealing with this issue. So UT's not the only one dealing with the issue. There's other universities too. They come getting them together and let's come up with a strategic plan for Texas and, you know, see how we can get it implemented. I think that's a good idea.
Thanks. As a Texas resident and a proud Texan, I guess the question is a simple one. You know, empirical data shows we've got the highest uninsured rate in the country right now. Is it just a fact or is it a problem?
Well, I mean, I think, again, I'll assume that that's a fact, but I don't know that we have an inalienable right for insurance. I mean, last time I read the Constitution, which wasn't that long ago, that's not a God-given right that we have insurance or health care coverage. Now, would it be nice if everybody had coverage? Yeah, it would be nice, but in my opinion, that's not necessarily, other than the bottom safety net that we've talked about before for those people, that's not a core government service. Now, there are people that disagree with me on that, and I respect those people quite a bit, but personally, I don't think that's something that the government should be in the business of, again, except for providing the safety net for those people that have no other way to cover themselves.
I'll also say this, you know, early in my married life, we had a period of time when we didn't have health insurance. But as a couple, we still made sure that our children received care. And I think a lot of people equate not having coverage to not having care. And that's not always the case. We paid for our care out of our own pocket. Our children needed to go see the pediatrician. We paid for it out of our own pocket. And there are a lot of folks that do that. There are folks that are subscribing to direct primary care models, where they're, you know, paying a monthly amount to see a physician whenever the need arises. There are different models out there, but just because someone doesn't have health insurance does not mean that they do not have access to care.
Have a couple of minutes left.
I think that's about it.
I'd like to raise a question, I think, for Commissioner Smith, and it's regarding the 1115 waiver. And you've been following the strategy for the renewal of that waiver. Do you see any change in dealing with the legislature or the federal government given the change in the administration in Washington affecting the renewal of the 1115 waiver?
Well, the legislature is an easy one. We'll see when January comes where we are. But as far as the election and what that means on the 1115, and I know that many of you are aware that we went to CMS and met with leadership there on the 21st of October to begin our negotiations for the 1115. And so we have started that process, and I will assume that we will continue with that process. And however, I will say that each passing day will make and us reaching an agreement probably less likely, just strictly because at some point you lose the administration appointed staff who were there, who will be going off to other jobs and those type of things. And so without having them to actually approve whatever the career people will decide will make it a little bit challenging. And I would also imagine that for even those career people who are at CMS, as they look ahead to try and figure out what their new bosses are going to want and the direction that they want to move in, there will likely be some resistance or reluctance anyway to really kind of stick a stake in the ground and say this is our opinion, because as we all are assuming that things are going to definitely change. And so as we kind of move forward, I think part of this will be getting a better understanding of where CMS stands today on the issues, and then coming back after January 20th to see if they're, maybe a little bit later than that, see what other type of movement will occur, because it's going to be based upon what President-elect Trump and who he brings in to lead the agency, and the speed at which they begin and want to implement change into the healthcare system in the country will have an impact on it. Now, what it does do, and what I was hoping to accomplish through this process, was that we would have at least a better understanding, if not an agreement, by the middle of December. So that way we would at least allow the legislature to see where the goalposts are. And if there were any things that they felt they wanted to do or needed to do going forward throughout the next legislative session, they would have the time in which to act upon that. Because the current 1115 waiver ends December 31st, 2017. Of course, this is our only legislative session between now and then. And so if we move beyond this process, we move beyond the legislative session, then we would have no other opportunity for the legislature to really enact or act upon this circumstance. And so we would then probably seek another extension or something along those lines to at least allow the administration to do whatever it chooses to do, and for us to then react to that in Texas, whether that's whatever that may be. And so that's the way we're going to probably attack it, is to see what we can, if we can find where using football sports analogies, I'm sorry, where the goalposts are, the sidelines. We want to get the boundaries, and then if we can understand that, then maybe we can have time to start anticipating what the future will look like, and then the legislature will have an opportunity to react to that possibly before April 30th, when their budgetary process all begins.
Thank you. Let's thank our panelists. Jamie is the boss, so she gives us some more time. We got some more time.
Person ask a question.
Commissioner Smith, along those same lines regarding conversations with the new administration and Congress, aside from just the 1115 waiver, what other type of discussions will you all be having with our members of Congress about the healthcare infrastructure in Texas? Will you be pushing for block grants? Will you be communicating what we'd like to see with 1115 instead of just waiting to see what those goalposts look like?
Well, I will say that we will provide every opportunity for impact that is afforded to us. We'll respond. We will also make sure that with any, like we would in any other proposal that the administration would have, we will work with our congressional delegation so that they have an understanding of how that impacts the state. And so that's part of informing the process, and so we'll make sure that we're doing that. And so if there are conversations about whether it's block grants or future 1115 or what the different ramifications are associated with those, then we will respond and work with leadership, governor's office, legislative leadership, to make sure that we're effectively communicating the Texas position on each of those aspects, and then we'll work through that process from there.
Now, thank you. Thank our panelists.